Hi, my name is Lisa and I'm one of the community heart failure specialist nurses in Gloucestershire. I'm going to talk to you a little bit about our service and the reason why you have been referred to us and about your diagnosis. First off, I'd like to explain that we are a community-based service. We work for the Gloucestershire Health and Care NHS Trust and we work independently from your GP surgeries. However, we do work really closely with your GP to keep them fully informed with what we're doing and any medication changes and updates on your condition. The purpose of our involvement in your care is to manage your symptoms that you may be experiencing from your diagnosis. This can be done with medication, which is what we initiate for you, and also with some self-help techniques that you can utilise yourself. We will review you either face-to-face, at home or in clinic, via telephone consultation or with video consultation. Hopefully your nurse has already spoken to you and has given you a heart failure booklet or signposted you to where you can access that online. Your nurse should have explained to you about what your heart condition is. We call this heart condition heart failure. It sounds like a really scary term, and this is a condition that we need to take seriously. However, it does not mean that your heart has failed, but it's the term that we use to describe the fact that the heart is not pumping quite as efficiently as it should do. There are a number of reasons why this can happen. The most common causes are a previous heart attack, previously uncontrolled high blood pressure, an irregular heart rhythm such as atrial fibrillation, type 2 diabetes, and sometimes a virus can cause damage to the heart. The heart is a pump. It pumps your blood out of the heart and around the body to your other organs to provide it with blood and oxygen. If your heart muscle becomes damaged, either through the heart attack or persistent high blood pressure, then the pumping ability of the main pumping chamber of the heart can be reduced. That means that if the heart's not squeezing with as much oomph, the amount of blood that's carrying the oxygen is reduced coming out of the heart and to the body. This causes congestion within the heart and causes increase of pressure within the lungs. This increasing pressure forces fluid from the air bags out into the surrounding air of the lung, and this fluid can make you feel breathless. This also can happen in the feet and ankles. The change in pressure within the system forces the fluid from the blood circulatory system out into the tissues where it's not meant to be. The symptoms that can be associated with heart failure is generally breathlessness, and this is caused by fluid building up on the lungs due to an increased pressure within the blood system. You can also get fluid building up in the feet and ankles, and that is through gravity and the feet being the furthest away from the heart. You may also notice that you feel very tired and fatigued, have a dry hacking cough, or occasionally a productive cough, especially in the mornings or when lying down. When you speak to your heart failure nurse, they will assess your symptoms and signs. This includes blood pressure and pulse. So they will ask you about your breathing. Are you getting breathless? What kind of activity will make you breathless? They'll also ask you about how well you are sleeping and how many pillows you sleep on at night to get comfortable. This is always a very strange question about how many pillows that you sleep on, but it's really important to us because it helps us gauge whether that fluid is starting to build up on your lungs. If you imagine that this water bottle is your lung, if there is any fluid on your lungs and you are sitting upright, then the fluid will fall to the bottom of that lung and you still have quite a lot of space to be able to use for your breathing. When you lie more flat, that fluid starts to bottom out and take up more surface area of the lung and can make you feel short of breath. We ask you about how many pillows you sleep on, because if you are getting short of breath and waking up when you are lying flat, sometimes having more pillows and sleeping more upright can help with your breathing. So it's a good way for us to assess if your breathing is getting worse. You may not notice actually that you are getting more breathless lying down, but if you're adding in an extra pillow, then that can be quite significant. So do let us know and be honest with your answers, because it does help how we treat things. It is also important that if you smoke cigarettes or vape, that you stop doing this, because it has a very detrimental effect to your heart condition and to your breathing. I've talked about sleeping and the position of your sleeping. If when you're sleeping you're finding that you are waking up with shortness of breath and feeling that you need to have some fresh air blowing on your face, this can be a very significant sign, and that you need to seek advice and treatment quickly. This isn't normal to be waking up short of breath, and the sooner we know about it, the sooner we can help ease those symptoms, and usually that is done with water tablets to help get rid of that excess fluid and make you wee it out. Your nurse will also ask you about your diet and whether you've got a good appetite. It's also really important for your heart health to follow a healthy, balanced diet with plenty of fruit and vegetables, reducing the amount of processed foods and fatty foods within your diet. We will also ask you about your salt intake. This is important because a high level of salt in your body can increase up your blood pressure and also helps the body to retain fluid. We will advise you to have a minimum amount of salt and either add the salt whilst you are cooking and not at the dinner table, or don't add it whilst cooking and add a little bit to taste at the table. Please do not be tempted to use salt replacement products such as low salt. This replaces the sodium in the salt with potassium, and the medications that we use can affect the potassium level in your body, so we need to make sure that we're not adding to that with salt. This heart condition is predominantly about fluid, and fluid building up in places where it shouldn't be. I've already mentioned fluid building up on the lung and that causing the breathlessness. And fluid can also build up in the feet and ankles. So it is important that we establish how much fluid you are drinking in an average day. And this can be all fluid, so not just water, but includes tea, coffee, water, juice, milk, and alcohol. If we are being very strict, then it will even include ice cream, jelly, and gravy. We will advise you to only consume 2 litres of fluid a day. The reason for this is that the more volume of fluid that you are drinking, the more the heart has to pump to shift that fluid around the body. And if the heart is needing to work more, it's going to become more tired, and then it's more likely to retain that fluid. One way to notice if you are retaining that fluid or drinking too much will be in your weight, and I will discuss that a little bit later when it comes to assessing. We will also ask you about your alcohol intake. We have to recommend that you follow the government's guidelines on alcohol consumption, which for an adult, both male and female, is 14 units per week. You are able to drink with most of the medications that we will be prescribing you, and we will advise you if alcohol is not advised in that situation. However, if your heart condition has been caused by a previously high alcohol intake, which can happen, then you will need to stop drinking alcohol completely. Another important aspect of your life to consider is activity and exercise. As this heart condition makes you feel very breathless, at times you may not feel that you are able to take as much activity as you would like to because you are feeling short of breath. Because the heart is a muscle and a pump, it's important to keep as active as you possibly can, either through walking, climbing stairs. If you're feeling up to it, then you can maybe go for a very gentle jog or join a gym and be advised by the personal trainers in that situation. If you are finding that you are getting breathless when you are doing some activity, or you experience any pain, whether that's chest pain or general pain around the body, then we would advise that you stop, take a break, and then restart that activity when you feel able. You should be able to hold a full conversation whilst you are doing that activity. If you are starting to exercise because you've not done much previously, then it is important to start slow and then gradually build up over the weeks to get to a level that you are comfortable with. And your nurse can discuss this with you in more detail when you see them. It's very natural with this heart condition or with any chronic illness that it may affect your mood and how you are feeling in yourself, how you're feeling with your family, and that can be a big worry to some people. It is perfectly natural to feel anxious and low in mood when you're told that you have got a heart condition. Your nurse will be there to help support you and talk through any concerns that you may have in this regard. Within Gloucestershire, there are other services that can also help if you need somebody else to talk to about your heart condition and about your feelings. I mentioned a little bit earlier that you may experience some pain. Because this is a heart condition, you may also have some ischemic heart disease, which can cause chest pain and angina type pain. This may not always present as a crushing, tight chest that you see on the TV, but can sometimes just be a little niggle or a tightness or a general discomfort across the chest. If you notice anything like this, then please let your GP or your heart nurse know, and if it does not go away with rest, then you need to call 999. You may also experience some palpitations or flutterings in the chest, which can come on at any time and might just feel a little bit like there's a butterfly fluttering around in your chest. This can sometimes be quite normal, and having an awareness of your heartbeat, a lot of people do experience, but if it becomes persistent or doesn't go away with rest, then let your heart nurse know, and that may well need more investigation. If you get general pain, then you can take painkillers for that. Most painkillers will not affect the other medications that we prescribe you. However, there is one group of drugs that you need to avoid as a pain relieving drug. These are the non-steroidal anti-inflammatory drugs such as ibuprofen, Nurofen, Voltarol, diclofenac. This also includes the Voltarol gels that you may need to rub onto your knees or joints to help relieve pain there. The reason why we advise you not to use these drugs is because there is a known link to this group of drugs and making heart conditions worse. If you need to take pain relief, then paracetamol is safe to use, or speak to your GP about getting something stronger if the paracetamol does not help. It's also important that you have your annual flu jab, and your GP should remind you to have this done in October, but if we are still seeing you, then we will remind you come the autumn to go and have your flu jab. This will help to protect you from flu, which if you do get symptoms of the flu, it will exacerbate your breathlessness and make you feel very unwell. So when you speak to your heart nurse, we will assess your symptoms as I have just described, and we will also do some physical examinations. Firstly, this will be to check your blood pressure and your pulse. The medications that we use help to lower your blood pressure, and we expect blood pressures to be on the lower side. That means that the top number, the systolic reading, we like it to be around about 100 millimetres of mercury systolic. Now, lots of people say that that's really low, but the purpose of you seeing us is that we can monitor things very closely and adjust your medication and to support you through feeling having a low blood pressure, which can sometimes make you feel dizzy. If you do experience dizziness, then let us know, and as I said, we may need to adjust your medication, but it's often something that you will be encouraged to live with and take steps to reduce your risk of falling. So if you've been led down for a while, when you sit up and before you get up and move, make sure that you've got your balance and that you're not feeling dizzy before you walk. It can be really useful if you have a blood pressure machine at home. You can either purchase these online or at a pharmacy, or even discuss with your GP, as they may have a blood pressure machine that you can borrow for the duration of your treatment. Because the medications that we use affect your blood pressure, then it's really important that we monitor your blood pressure and make sure it's not too high or too low at those times. The blood pressure machine will also record your pulse. However, it will not tell us if your pulse is a normal, regular rhythm or if it is irregular and jumping around a little bit. But you may notice this with some palpitations. We will sometimes listen to your chest as well with a stethoscope to listen to see if there is any fluid building up on the lungs. If you do have the fluid on the lungs, which I mentioned earlier, that will make you more breathless and you may experience a cough. We will also check your feet and ankles for swelling in the ankles. If we are seeing you face to face, then obviously your nurse will check that, but if we are talking to you on the phone or via video conference, then you can check for that fluid yourself. And I have a doll here to show you how to check for your own fluid. So you may notice that there is fluid in your feet anyway, because your shoes and socks are feeling more tight than they normally do. But sometimes that fluid isn't as noticeable, but it is there. So how we test for that is if you take off your socks and pull up your trouser leg, then press firmly on the top of the foot for 5 to 10 seconds. So you should be leaving a divot in the skin. So press for 5 to 10 seconds, release your finger, and then have a look to see whether the skin has popped back up to normal or whether there is still a fingerprint mark in the skin. If there is a fingerprint mark left in the skin, then that can be an indication that there is fluid building up in your feet and ankles. If there is fluid there, then the nurse will ask you to keep pressing in the same way for 5 to 10 seconds, firmly, going up the leg until it doesn't leave that fingerprint mark anymore. In some situations, this fluid can be up in the thighs, sometimes round the base of the spine, and also in the stomach. We aim to not let the fluid get into those places as before, so we try and treat it before it gets up the leg and uncomfortable. As I mentioned earlier, the fluid builds up in the leg because of gravity and it being the furthest away from the heart. When you are sat down, if you can elevate your legs, then that's going to help with gravity and that fluid will drain a little bit better. So when you're sat down, lift your legs up as much as possible, or even if you've got very bad swelling, go to bed for the afternoon and lie on the bed for an hour or so just to help with that fluid. Now, to monitor this fluid building up, then you can monitor it by weighing yourself regularly. In this booklet, there's sections where you can record your weight. Now, we're not interested particularly in what your weight is, but more in the fluctuations of your weight. So if you weigh yourself every morning, before you get dressed and have breakfast, but after your morning wee, jump onto the scales and weigh yourself. Make a note of what that weight is, and if you notice over the days that your weight is increasing by 2 to 3 pounds or a kilogram in weight, then that is more likely to be fluid than diet weight. If it is fluid weight, then if we're able to, we will give you more water tablet to help the body suck that fluid back from the tissues where it's not meant to be, either in the feet and ankles or in the lungs, and make you wee it out. This can sometimes drop your blood pressure, so be careful if we increase up your water tablets. So I've just talked about assessing your symptoms and how we as nurses will assess your symptoms, but also how you can monitor your condition and when to seek help, and how to monitor your fluid balance and your weight, which can be a good indicator that things aren't going in the right direction and we need to act on that sooner rather than later. So I'm now going to talk to you about the medications that we will be using to help treat your heart condition. Your GP may already have started you on a water tablet, and this water tablet is to get rid of that fluid that's building up. The most common water tablets we use are called furosemide and bumetanide. With all our medications, we will adjust the doses according to your blood pressure and your kidney function, which we test with a blood test. So furosemide or diuretics are purely there as a symptom reliever. They do not actively treat your heart condition. They simply get rid of that fluid. The drugs that we use to treat and support your heart condition will be started by your heart nurse. The first drug that we usually start is called either an ACE inhibitor, an angiotensin receptor blocker, or a drug called Entresto, which is sacubitril valsartan. These drugs are the first drugs that we use because they help to lower the blood pressure, but also where the heart has become a little bit weak and is not pumping as efficiently, these drugs help to tighten up that heart muscle, so then it can help improve the way that the heart pumps and pumps the blood around the body. Common names for the ACE inhibitors, which is the angiotensin converting enzyme inhibitors, are called ramipril, enalapril, perindopril, and there are others which end in pril. If you don't tolerate ramipril, because it can sometimes cause a cough, then you will be changed onto one of the angiotensin receptor blockers, such as candesartan, losartan, those two. There are others which end in sartan. And then sometimes we will change you from ramipril or enalapril or candesartan to a new drug called Entresto. This drug works in a very similar way to ramipril, and your nurse will discuss that with you if it is appropriate for you to start on that drug. All three of these types of drugs affect your blood pressure in that it will lower your blood pressure, so you may experience some dizziness. They can also affect the kidney function, and it makes the kidneys work harder. So we need to check that with regular blood tests, and you will be asked to have a blood test 7 to 10 days after starting these drugs, or with any further drug increases, dose increases. We'll check this blood test and let you know whether we need to adjust the doses of your tablets. We always start off with a start low, go slow approach. So we will start these drugs at the lowest possible dose, and as your kidney function and blood pressure tolerate it, we will then start to increase up either the frequency of the drug, i.e. changing it from a once a day drug to a twice a day, or just increase up the dose to the maximum tolerated dose that suits you. The next group of drugs that we routinely use are called beta blockers. These are drugs such as bisoprolol, carvedilol, nebivolol, and any other drug that ends in ol. What beta blockers do is they help to lower your blood pressure, but also helps to regulate and control your heart rhythm and rate. So if you have atrial fibrillation, the irregular heart rhythm, this drug will commonly be used for that also, to help control that rhythm. In heart failure, we ideally would like your heart rate to be around about 60 beats per minute. If you are in atrial fibrillation, then the target will be 75 to 80 beats per minute. We will monitor your pulse, but again, if you feel dizzy or tired, then this may be an indication that your pulse is on the slower side and we need to adjust your medications. Your nurse will also record an ECG, a heart tracing, to keep an eye on your heart rate and rhythm. Side effects of beta blockers can be tiredness, and can also, when we initially start the drug or increase the drug, we know that they can make you feel a little bit worse before they start making you feel better. So you may notice an increase in your breathlessness or ankle swelling for the first couple of weeks after starting this drug. This is normal, but discuss it with your heart nurse if this is troubling you too much. Beta blockers can also make your fingers, toes, and the tip of your nose cold. Again, this is quite normal, but if you notice that your tips of your fingers and toes are starting to change colour, or there's a change of sensation, then let your GP or your heart nurse know, and we may need to adjust the beta blocker. But it's very normal to have very cold hands. The third drug that we often use, but may not need to use it for everybody, is a drug called spironolactone or eplerenone. What these drugs do is, again, lowers the blood pressure, but also works really well with the ramipril, or those type of drugs, and the beta blocker to give the heart more support and to prevent your heart condition from deteriorating, and hopefully will stop any further deterioration in your heart failure, as will the other drugs do this also. So those are the three main treatments that we use for heart failure. And as I said before, we start them on the lowest dose and gradually increase it as your blood pressure, your heart rate, and your kidney function tolerates. If at any point you do not feel comfortable with making these changes, or you do not wish to start on these tablets, then that is your choice, but we would like it if you would discuss it with your heart nurse at the time of that discussion to change the drug. These tablets will be for lifelong treatment. Please do not stop them unless you have discussed it with your GP, the cardiologist, or a heart nurse. Sometimes it's inevitable that you will need to go into hospital. If this does occur, the doctors there may want to adjust these heart drugs. Often there will be a good clinical reason for this, but if it would be beneficial if you could encourage them not to stop your heart failure treatment without them discussing it with the cardiologist, or you can give us a ring and we will discuss it with the doctor on the ward. Other drugs that are routinely used in heart failure can be ivabradine, which helps to regulate the heart rhythm, and digoxin, which also helps to regulate the heart rhythm. With all your medications, it's really important that you do not run out of your tablets. So you need to be organised to arrange either with your pharmacy that there is a regular prescription going through to your pharmacy to get your drugs. This can often be difficult with us changing the doses of your drugs, in which means that you may go through your tablets more quickly than is actually prescribed. If you have issues with getting your prescriptions, then let us know and we may be able to help. If you are unsure about any over-the-counter medications such as painkillers or multivitamins or anything else that you may consider taking, maybe such for hay fever, then the best person to speak to about whether they work with the tablets that you are taking, go and speak to your pharmacist. They will be able to advise fully on whether it is safe to take that medication. Another thing that's really important to consider is if you are feeling poorly for another reason, such as a stomach bug. If you are vomiting or have diarrhea, then this will affect how the tablets that you are taking for your heart or any other tablet, it affects how they work. So if you have got a tummy bug, then speak to your heart nurse or a pharmacist and they can advise you on what to do with your medications, especially with your water tablets, because there would be a risk of dehydration. So I've talked to you a lot about your heart condition and how it affects you and how it presents with any symptoms and how we monitor it and manage it. So it's really important that you work closely with your heart nurse and discuss any concerns that you may have about your heart condition. Please let us know if you are noticing that you are getting more short of breath, or you are gaining weight, or you are getting ankle swelling. If we recognise these symptoms earlier, then it is a lot easier for us to treat it and for you to get back to your normal routine with your medications. Once we have managed to get you on all the right medication and your condition is stable, then we will refer you back to your GP for them to continue your monitoring of your blood pressure and your kidney function. Your kidney function blood test will need to be taken minimum every 6 months. And your GP should invite you to the surgery annually to have your blood pressure checked and have a full check over. There are other organisations that can help you and support you with your diagnosis of heart failure. The Pumping Marvellous charity has a website and a Facebook page which is really useful to get support from other people who have experienced and have also had a diagnosis of heart failure. They run patient forums and also have medical advisors that can advise and support or answer any questions that you may have. So that's a really valuable tool to access if you are able to. The British Heart Foundation is also a useful charity and obviously helps to support the work of our heart failure nurses around the country. So they are a wealth of knowledge and also have a telephone support line if you need to access that. And of course, we as the Heart Service are here for the duration of your treatment with us. You can telephone us at any point. We do have an answer phone, so please bear in mind that if you are feeling more breathless or have other symptoms, chest pain or anything like that, please do not phone us and leave a message on our answer phone, because that will need more urgent attention and you should either speak to your GP, NHS 111 or 999. If you just have a normal query or something that you can leave a message for your heart nurse, then please do give the service a ring, and we will get back to you when we are next able to do that. If your nurse is not available on that day, then one of our other nurses may contact you to discuss your treatment. We will share your information with your GP, either through telephone calls or letters, and many of the GPs around the county do use the same computer system as we do, so they can see the notes that we have written. Your nurse will ask you for your consent for us to share this treatment, this information with your GP surgery or any other medical profession that may need to be involved. Our service is open Monday to Friday, 9 to 5. We are not open bank holidays. If you have any questions, do speak to your nurse that is designated to you, and they will be happy to answer them. I hope this video has been useful for you and that the information helps to support your own management of your heart condition. If you do have any other questions, please let us know and refer back to this at any point to clarify any points that are necessary for your effective treatment. Thank you. Bye-bye.